Thank you, Dr. Neha, for giving me this opportunity on your prestigious platform of Aarogyam. And you actually would be able to imagine the kind of help you have given to us, to our organization, in spreading this awareness word about this slightly less known problem of abdominal cancers. I am a practicing gastrointestinal surgeon where 60 to 70% of our patients are related to abdominal cancers. When I say abdomen, I hope that I presume that most of our audience are aware of what is the meaning of abdomen. In case they are not, abdomen is the area between the waistline and the rib cage. And there are a lot of organs inside that, or that thing, which in normal casual English we call as tummy. So today we are starting a 4-week weekly session on awareness on various aspects of abdominal cancers, and our stress would be on two important things. One is to make all of us understand that by 90% of these cancers, they are preventable. Normal notion is that most of the cancers are genetic in origin, and actually we don't have anything to save us from getting these cancers, which is not true, because in 90% of the cancers, it is our lifestyle and environmental factors which makes us suffer from this deadly disease. Second important aspect which we will be discussing about would be, that how to get this disease diagnosed at the earliest, in case there is some unfortunate person who has got this disease, so that they can be treated on time. So on these two things we would be discussing, and today is the first session of weekly. It will be a weekly thing for 4 weeks, and the whole thing is divided into 4 modules. So today we are just, let me share my screen. Is my screen visible?
Yes.
Okay. So I hope you are able to see this slide.
Yes, we can.
Okay, thank you. So let us start our topic of discussion, that is abdominal cancers. They are preventable, they are treatable, yet they are a killer disease. So this is a graphic which I have taken from internet, and you can see that there are 2 windows. One is an expert sitting, who is an expert in lifestyle change, how we can change our lifestyle to get ourselves prevented from getting many diseases, which are, most of them are life-threatening. And there is another window with a long queue where toxic pills and surgical treatment is being offered to the patients. And you can see the difference. I mean, it's a self-explanatory picture, and actually we are having this reality. It's a reality rather than a shared depiction. Let me give you about the abdominal organs, something about abdominal organs. We have around 7-8 important abdominal organs. And if I name them, they include esophagus, that is also known as food pipe, stomach, pancreas, liver, gallbladder, appendix, colon, and rectum. So in 2019, we have come up with the idea of Abdominal Cancer Day, as we have Cancer Day, World Cancer Day, which is approaching tomorrow, 4th of February. And the idea is to, by virtue of this day, we want to create a noise level about abdominal cancers. And through that, the aim is to save lives. So this logo was defined. It's a slightly important, it is interesting. So I will give slight explanation about what it means and what is the meaning of these colors and everything. So all these colors are organ specific colors which are designed and defined for that particular cancer. Like esophagus cancer, this color is designated to esophageal cancer. Similarly, liver, pancreas, and so on and so forth. And the center color, this purple color means the patient who has been cured of cancer. Since 2019, we have been doing this annual activity. Now, what is the need of this? You will be able to understand in coming presentation. So first we have to understand that is this such a big problem that we need such a dedicate, such a allocation of resources in terms of time or money that we need to observe it on annual basis. We need to hold such kind of presentations. Incidence of gastrointestinal cancers are rising globally, and they contribute 26% of the total incidence and 35% of overall cancer-related deaths worldwide, which is a very significantly high figure. But important thing is the next line, they are predicted to increase by 58% and 73% to 7.5 and 5.6 million respectively by 2040. Means the total incidence is expected to rise from present 26% to 58%, and overall cancer related deaths from 35% to 73% by 2040. So you can see that how big this public health problem. There is a visible rise in incidence of these cancers among patients of age group 20 to 50 years, when previously it was predominantly the disease of more than 50 years of age. This is another important aspect, because now this disease, the age distribution is shifting towards the younger age group, which is the productive age group. And it's really very, very distressing to know. There are few issues which are unique to gastrointestinal cancers in comparison to other cancers. One is patient's ignorance causing patient delay in reaching out to doctor. In most of the gastrointestinal cancers, there has been a significant delay on part of the patient after they notice first symptom to reach to a general physician for the first consultation. There is a difficulty in having them diagnosed in early stages, and therefore early and curative treatment is a problem. Another point is problem with and overall prognosis. Am I audible to all of you?
Can't hear you clearly.
Sorry, the audio is breaking.
Cutting off in a bit. Yeah, it's breaking.
Okay, voice is breaking.
With his low.
Okay, let me just a moment. Give me a moment. Is it any better?
Yes, it's better now.
Okay, okay. So these are the issues which are unique to GI cancers, and we will see in our presentation how we can, despite these early treatment of these cancers. So this line is important, and I want to stress this line a little bit further. When I say that to help, so that people help themselves in prevention and early treatment, what is the meaning of that? It means that we need to educate people, make people aware to that extent that they are not dependent on their doctor on the advice whether to see a specialist or not. They should themselves be aware to the extent that they, whenever a symptom, maybe a very trivial symptom occurs, They understand it's important and its possible association with some of the cancers. And in case the general physician is not able to diagnose it properly or take it seriously, they themselves are aware to that extent that they can demand from the doctor that, please, I am fearing that I may be having this particular kind of problem. So please get me some test to rule that problem out. Cancer is the second leading cause of death, first being cardiovascular diseases. Worldwide among cancers, the maximum deaths occur from tracheal, bronchus, and lung cancer, that is airway tract. And the second most common cancer death cause is abdominal cancers like stomach, colon, rectum, and liver cancers. Still, there is no alarm in our minds when we suffer from some symptom of abdomen like that. What happens for chest symptoms? For example, in any meeting, God forbid, if somebody gets a pain in the chest, because of the today's awareness, that person will stop doing whatever he or she is doing, will rush to the cardiologist or chest physician and that get themselves checked for any heart ailment, and then only will resume normal life. But in abdomen, the thing is absolutely opposite, because person, they just keep on tolerating those symptoms till they reach a point where they are unable to do their basic daily activities. And in that process, they end up increasing the stage and making the disease incurable. About 20% of males and 70% of females will get cancer at some point in life, and 13% males and 9% of females will die from it. So this is, you see, this is a significant figure, and we can change it by mere awareness. Here I'm just pressing upon the causes of death. Cardiovascular, as I said, 1/3 of the deaths are because of cardiovascular causes, and the second commonest death is because of cancers. Now, this is important. The number of deaths by risk factor: high blood pressure, smoking, high blood sugar, obesity, high cholesterol, alcohol, diet low in fruits and vegetables, low physical activity. So you must be wondering that why I have put this slide over here. This is because all these high risk factors, they increase our chance to get abdominal cancers. This is very important to understand. In the whole world, cancer death rates by type, there are 10 causes of cancer deaths, and out of these 10 causes, 6 belong to abdominal cancers. So 60% of all the cancer deaths are because of abdomen. These are survival statistics. Between 75 to 1980, 49% were alive after 5 years of diagnosis. And by 2010, this figure has increased from 50% to almost 70%. That means 5 years survival after diagnosis of cancer. And on another front, in 1990, 160 people out of every lakh globally died from cancer. And this has decreased in 25 years to 134. But they show some improvement, but they are too small. And we want to increase these figures, this one and this one. And these figures can only be increased not by any scientific advancement, not by technological advancement, by only creating awareness among people. All the advancements will only help to those people who are reaching out to the doctor. And there lies the problem. Long back, Gautam Buddha has said every human being is the author of his or her own health or disease. And it is absolutely true when it comes to abdominal cancers also. Now we'll discuss few things about the causes and prevention, because if we want to prevent ourselves from anything, we must first understand the causes and then to remove those causes from our lives. 90 to 95% of cancers, as I have already mentioned, are related to environmental and lifestyle factors, and only 5 to 10% are due to genetics. Out of all the colorectal cancers, only 3% of them are because of faulty genetics. Common environmental factors include tobacco, contributes to 25 to 30% of all the incidents. And you see, this is totally controllable. We can totally remove it from our lives. Alcohol, 10% cancers in male and 3% cancers in females globally. And they are mainly liver and digestive tract cancers. So these 10% can also be removed easily. I mean, these 40% of this particular thing, tobacco and alcohol, is totally in our hands, and we are not dependent on anybody to remove these two things from our lives. Diet and obesity, another 30 to 35% risk of cancer. Diet which is low in fruits and vegetables and high in red or processed meat increase the chance of colon and pancreatic cancer. We have full control on this factor also. Infections, hepatitis B, hepatitis C, and H. pylori, prevented by vaccination and proper treatment. Radiations 10%, stress, lack of physical activity, and pollution, rest of the causes, and autoimmune disease like ulcerative colitis and Crohn's disease. And mind you, cancer is not a transmissible disease. Many times my patient's relative comes to me and they ask me, can we go near to the patient? We have child in our house, we have older people in our house, and is there any risk of this cancer being transmitted to them? So it is not a transmissible disease. Now, abdominal cancer. So far we have discussed, just enumerated the preventive causes which can be easily prevented. Now we come to the prognosis of abdominal cancer. What are the factors which are responsible for the overall prognosis? When I say prognosis, I mean the overall outcome. There are factors which make the overall outcome bad. And what are those factors in abdominal cancers? One is type of cancer. Second is stage of the cancer at the time of diagnosis. And third is overall health of the patient. Cancer type means, in abdominal cancer means, which organ of abdomen it is arising from. Say, for example, of all the abdominal cancers, 3 most lethal cancers belongs to pancreas, gallbladder, and esophagus. Stage of the disease, we will see in forthcoming slides how it affects the prognosis. And overall health of the patient is very important, because at the time of getting this cancer, if the patient's overall health is not good, he or she may not be able to sustain the stress of the treatment process. Now, coming to the cancer stage, of all the 3 things, stage is of most important thing. Stage 1 to 4. These are the 4 stages of cancer, and stage 1 means when a cancer is small and localized to the organ of origin. Stage 2 is large but localized. Stage 3 is cancer is big enough to invade or to affect the adjacent organ or lymph nodes. And stage 4 is when it has spread to other parts of the body which are distant from the organ of origin. In last 15 years, we have seen many patients of abdominal cancers, and out of all of them, 60% of them belong to stage 4 cancer, 25% in stage 3, and 15% in stage 1 and 2. So the important thing to understand is that stage 4 disease means what we call as last stage cancer, where majority of the patients are not amenable to curative treatment. We cannot have any cure for these patients. And you see,
We can't hear you.
We can't hear you. Hello?
I think we have lost Dr. Jain. I'll try to connect again.
the rest belong to stage 3 and 4. So now the next question arises, why majority of our patients are not coming in stage 1 and 2 and they are coming in stage 3 and 4, or only in stage 4, which is two-thirds of the patients. When we digged our data further, we found that the answer lies in time to presentation. the time between development of first symptom and first visit to, this is my data, so here it's me as first GI surgeon, only 20% of them reported to me within 30 days of symptoms, 40% within 3 months, 20% within 6 months, 10% took up to 1 year, and there were 10% patients who took even more than 1 year to present to a doctor. So what is the significance of this data? The significance is that higher the duration of illness, higher is the stage of disease. Higher is the stage of the disease, lesser is the chance of cure, and thus lesser is the survival. Higher is the stage, higher is the chance of recurrence, metastasis, and spread even after good treatment. Higher is the stage, higher is the need for chemo and radiotherapy. Higher is the stage, higher is the suffering of the patient in terms of disease-related suffering and treatment-related complications. Higher is the stage, lesser is the survival and quality of life. Higher is the stage, higher is the cost of treatment. So you see, all these are the negative points attached to the higher stage at the time of diagnosis. Come to the importance of early diagnosis in abdominal cancers. Cancer survival can be significantly improved by reducing the number and proportion of cancers diagnosed and treated at a late stage. Cancers of delayed diagnosis, cancers with delayed diagnosis have following causes. Patients who have no awareness of cancer signs and symptoms. Some people don't see a doctor out of fear. There is no understanding of the fact that any abdominal symptoms persisting beyond 3 weeks can be a sign of some form of abdominal cancer and thus can be a life-threatening thing. Please remember, when it comes to your health, you are in charge. If you do spot something unusual, please visit and tell your doctor. In most cases, it won't be a cancer, but even if it is a cancer, finding it early can make a real difference. And please just spread the word and understand yourself. Cancer is not a death sentence. Any disease can result into death, and death is not only because of cancers. And like other diseases, cancer is also a curable disease, provided patient reaches the doctor on time. The fact is that we all are going to die at some point, but death as a direct result of abdominal cancer is usually not the case if it is diagnosed early and treated properly. Increasing number of patients survive abdominal cancer and go on to live a normal active life thereafter. This is from my own experience of last 15 years. We have cancer of all kinds of gastrointestinal tract, including liver, pancreas, where we have examples of people who are living for more than 10 years after successful treatment. This is a slide which shows the survival figures presently throughout the globe, and you see the majority of the cancers have a good 1 year survival, and it decreases significantly when it reaches to 5 years and 10. All types of cancers, including stage 3 and 4. Now, if you just imagine that if we are able to subtract 60% of late presenters who are stage 4 disease and into stage 1 and 2, how promising this slide would be in terms of survival. So friends, what we are looking for through these presentations is to create awareness so that we queue up in this line where we are seeking lifestyle change to prevent ourselves from getting these kind of deadly diseases, and let people like us, surgeons, medical oncologists, and all those doctors who are into treatment of cancers, like, just lying idly without having any patient to treat. That would be an ideal situation. So thank you very much for your patient listening. Hope that you had understood the scientific part of the presentation, and if there are any questions, you are welcome to ask.